And here at Living 808, we want to stand up and just knock cancer out. And so does Queens Hospital. And Dr. Erin Capps is one of the wonderful doctors here at Queens talking about, and we want to focus on breast cancer awareness. Now, we're standing behind the mammogram machine, but for anybody who doesn't know, what is a mammogram, doctor?
So a mammogram is a screening study of the breast tissue, and basically it's an x-ray of the breast. And we're looking to find subtle changes or small cancers within the breast that are able to be treated, and that's the reason we recommend doing them routinely and yearly for women.
And when you say routinely and yearly, what age or when should a woman start coming and getting a mammogram on a regular basis? Yes.
Yeah, so for women of average risk, we recommend beginning mammograms at age 40. We know that the rate of breast cancer increases as we get older, but there is a significant change at about the age, somewhere around age 40, where we see that risk begin to increase. So we recommend women start at age 40 and have a mammogram every year.
Is there any other, I guess, risk factors or other contributing things that may also depend on that? Start earlier, start later?
Of course. So women with family history, so if mom, sister, daughter, in particular those first-degree relatives, if there is a strong family history, then that would be a reason to consider needing to have early screening and to start earlier. And so you'd want to talk to your doctor about those risks. However, we want to point out that most breast cancers occur in women with no family history. So,
really?
Yeah. So,
I did not know that.
Yeah. So about 70% of breast cancer actually occurs in women with no family history. So just because you don't have a family history, we don't want you to ignore and think that you're not at risk.
And I'm sorry, that's shocking figures. I didn't know that. Now, when it comes to mammogram, I mean, it's not something someone should be scared of, right? I mean, you come in, you do it. I mean, it's important to know. It's something you really shouldn't be fearful of, right?
Exactly. So I know it is very stressful for women to think about, but we want to, present that this is just a screening study, and really to just
to know.
Yeah.
Yeah. So no, we're done. And I got to ask you, we're talking right behind me this machine here, but you were talking earlier about 2D and 3D. Why is 3D? And you guys have the 3D. Why is 3D so important, especially for a mammogram?
Yeah, so with a 2D mammogram, basically we get one image of the breast from the top and one image from the side. And when we do that, we push normal tissue together. And so that normal tissue may overlap and it may hide a small mass, okay? So when you do 3D, it's basically slices through the breast. And so we're able to kind of look at the breast tissue layer by layer. And that allows us to find smaller cancers and to separate out normal tissue. So not only does it help us find more cancers, it also helps us know when something is normal.
Normal, right?
Yeah,
no false positives right
exactly.
there.
So we decrease the amount of times when we get called back for an abnormal study, but we also find more and smaller cancers.
You know, you were talking earlier, and we love Queens, but one of the great things that you do have, if someone does discover cancer and begins the journey, there's someone that kind of gets assigned to you for this journey, right? And it's really an important part of your whole overall Queens Health. What is that?
So, when you have a mammogram and there's an abnormal finding, okay, so that happens on a small number of our screening studies, okay? And we don't want women to get alarmed up front because the majority of those are just going to require a few additional films or additional mammographic images, additional ultrasound, and be cleared, okay? But a small number of the women who do get called back will need more workup or maybe even a needle biopsy, okay? So if that happens, we assign that woman to a patient navigator. And that navigator, really assists the woman in knowing what to expect, helps in scheduling and kind of navigating the whole process from the time of screening mammogram to a diagnostic mammogram to the biopsy. And then beyond that, determining on if those results are significant and anything else needs to be done, kind of helping her through that process.
That's amazing. Doctor, I love how you say that because, if something is discovered or isn't, there's a wealth of information, emotion that's going through. So having somebody like that that's comfortable and kind of been through the process with other people really makes a difference, doesn't it?
Yeah, it really does.
Now, speaking of the patient, this month, October, you guys have, if someone wants to, you're maybe on the fence, but when I come down, you guys kind of got a mammogram issue, or special, as we'd like to say, right?
Yeah, so October is Breast Cancer Awareness Month, and we want to encourage women to have a mammogram. If you haven't had a mammogram before and you're 40 years or older, then this is a great time to start. If it's been a while since you've had one, go ahead and schedule your mammogram. And in the month of October, Queens does provide a free gift for all women who schedule a mammogram.
I love that. And doctor, please, for anybody out there, if they're on the fence, they're like, oh, I'm too busy, or I'm saying, coming down and getting it's not that much time. It's not, and knowing that peace of mind is worth a lot, isn't it?
It certainly is. And so we'd like to encourage you to go ahead and schedule the mammogram. It is 10-15 minutes out of your day, but you know, to really the benefits you gain and the knowledge you gain
Yeah.
of having that negative mammogram is
worth it.
Is worth it.
It's worth
for
it.
Sure.
That peace of mind, knowing that you're okay, and then if something happens, that early detection is so important, right?
Yeah, exactly. So that's the point of mammography, is to try and find them early, small, when they're most treatable and you know, most curable.
That's right, and get you back on your feet. That's what we love about Queens. We're gonna have all the information on our website to lead to them. But please, this is your life we're talking about, and breast cancer awareness. We want to make sure you're aware, but also get down to Queens. The amazing equipment we have here to make you be healthy and have that peace of mind. Doctor, thank you so much.
Thank you.
You know, Trini, right now, and you know this, we've talked, my grandmother right now is battling cancer at Queens, and she just finished her first round of chemotherapy, and they were talking about they assigned someone to go through you, that whole process. And that lady, we brought her cake, we brought cupcakes all down, because having somebody that's part of Queens that tells you everything, that holds your hand, that goes through all those emotions with you, I really think that is more, in some cases, better than medicine, you know, having that person be there for you.
Yeah, it's so important to have that support,
Yes.
right, all the way through. Going back to mammograms,
Yes.
it is uncomfortable, it's sometimes painful, but it is quick.
Yes.
It's important, and like you said, Taizo, early detection is so important, because if you catch it early, it's it's curable.
The
so
statistics
important.
are mind-boggling.
Yeah.
Like a couple months different makes a huge difference in the battle against cancer. And then, like you were saying, it is 15 minutes. It's a little cold, but with the new 3D technology they have, they don't have many false positives. So you just get in, get it done, and they can really tell in what's going on there. I love what Queens is doing.
Yeah,
Good stuff.
absolutely.